use later. What we're going to show now is the injection of Botox. We're going to talk about Botox. We mentioned how Botox just relaxes muscle function, how basically it prevents the neurotransmitters from releasing into the synapse, which is the little bit of a gap or trench between the nerve endings and the muscle. So the muscle does not get any signals from the nerve. This process goes on for about 3 or 4 months with each injection of Botox, and then it reverses with the nerve growing more endings and the old ones retracting back. So the process is completely reversible. It does not have any downsides. If anything, over time, people require less Botox as the muscle gets slightly weaker. But it's a very safe procedure. Now, the most common area for Botox is the area between the eyebrows for getting the frown lines. Kristen has had this area injected in the last several weeks, so it's still working very nicely for her. The second area is the crow's feet area. Now, typically, the company, as well as most doctors, place 1, 2, or 3 little drops laterally. But once you properly understand the anatomy, and you're comfortable with the musculature, and you've actually operated in that area, you know that it's very safe to actually have the Botox go from all this area, go underneath the eye, and even get some of the cheek, depending on how strong or how weak the crow's feet area are. Most younger patients still require just a few drops. However, as the crow's feet gets a little bit stronger and deeper, by relaxing this entire musculature in this area, you really nicely prevent the formation of the wrinkles. The important thing to consider in that area is that it's very vascular, and you want to make sure that the Botox is placed just underneath the skin and not directly into the muscle to prevent bruising and bleeding. We're going to get started with that. Ready to do the Botox injection. Kristen actually has never had it to this area. She's usually had it pretty much in the glabella between the eyebrows, so this is brand new for her. Put your hand back from me, Kristen, and take an alcohol wipe, as in any other area, and just wipe a little bit of the makeup off and sterilize the skin here. Now, we talked previously about Botox, and I mentioned how it's not important how many cc's that you have, it's important how many units that you have. Typically for the crow's feet area, each side requires 5, 10, or 15 units of Botox, depending again on the strength and the nature of the lines. What I do is I like to keep the Botox very concentrated, so the actual amount or volume of fluid that's being injected in that area is as least as it can possibly be. So 20 units of Botox means 10 units on either side, and roughly equates to about 0.4 cc's. And the way I get that is that I dilute my entire vial of Botox with only 2 cc's of saline. Now, some people choose to do it with 2.5 cc's, some people choose to do it with 4 cc's or even more. That just means that you have more saline or salt water that's diluting the Botox. We're going to get started here. The injection basically goes right underneath the skin. It creates a tiny small little bleb that resembles almost a bleb that you get after a TB test. This bleb goes down and goes away in about 10 minutes. And the reason you get this bleb is that you're putting the Botox directly underneath the skin and not into the musculature. I want you to notice that I'm actually coming out more centrally underneath the eyelid, and that is definitely more unconventional, but it works very nicely, and most patients are pleasantly surprised by this, especially if they've had Botox done in the past using different techniques. So several little injections. Then I ask my patient to hold a little bit of pressure with their hand in the area while I go on the other side. That didn't take very long, but the effects of it will last about 3 or 4 months. Same thing on this side. I use a little sponge with cold ice water to have the patients hold over the area after the injection. Now around this area, as I'm injecting, I'm actually pushing the Botox in as soon as it penetrates the skin. The reason for this is that I want the Botox to actually push any possible vessels or small capillaries out of the way. So there's less chance of the needle hitting these capillaries and creating bleeding or bruising. If you do this carefully, there's almost no problems with bleeding or bruising. She's doing fantastic. And her Botox treatment is over. Go ahead and hold this for me, Kristen. So this concludes our injection for Kristen. She bared it very nicely. The whole thing took less than 10 minutes. And with the Reston, the results last about 6 months. With the Botox, the results last about 3 or 4 months. And we'll see her back in a few months. Thank you. Thanks, Kristen.